Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Cancer is one of the most devastating diagnoses that one can receive, either for yourself or for your loved one. And one of the types of cancer is lung cancer that we want to talk about in this video. So cigarette smoking is known to be the most important factor that can increase the risk of somebody to have lung cancer. It is estimated that in some countries, especially in the high income countries, where the rates of smoking are very high, the rates of lung cancer are also very high. Almost 90% of all those who have been diagnosed with lung cancer have a history of smoking. So one of the other risk factors is what we call secondhand smoking. This is when we say secondhand, we mean somebody else is smoking and you are next to that person. And secondhand smoking, research has shown that it is almost as harmful as firsthand smoking. It can lead to lung cancer, but on top of that, it can also lead to other problems, especially for children who are victims of secondhand smoking, like ear infections, sinus infections, pneumonias, and others. Other risk factors for lung cancer that we should be aware of is occupation. So people who work in industries or in factories where they are exposed to different types of chemicals, different types of smokes which they inhale, if that goes on for a prolonged period of time, that can also damage your lungs and cause you to have a risk of lung cancer. The other important risk factor is what we call biomass fuel. Biomass fuel is basically the type of fuel that we use in wood and in charcoal. People who use wood and charcoal for cooking are exposed to those fumes, especially if it's a poorly ventilated room or an environment, closed spaces, and somebody is in that place cooking for a long period of time. That causes damage to the lungs and can increase your chances of lung cancer. Of course, family history is an important risk factor. If somebody in the family who has cancer, especially lung cancer, the other members of the family are also at risk of lung cancer. Increasing age, it is said that anybody above the age of 40, your risk of lung cancer starts to increase every year after the age of 40. And then finally, anybody who has chronic lung diseases. For example, we have a disease called COPD. We have a disease called lung fibrosis. All these diseases of the lungs that have been going on for a prolonged period of time reduces the immunity of the lung, and therefore you are more prone to cancers of the lung. So it's important to recognize these risk factors so that we can try and prevent or reduce the risk of lung cancer for ourselves and our loved ones. Why it's important to do that is because the symptoms of lung cancer are very non-specific. They're very general symptoms. For example, patients with lung cancer could have a cough, just a plain cough, for a very long period of time without any other symptoms. Or they may have sometimes cough with blood in their cough. So that's a very alarming sign that one should always seek help for. Otherwise, they may have chest pains. Chest pains can occur in any part of the chest, depending on where the cancer is. You can have difficulty with breathing, depending on where the location of the cancer is. But these symptoms can occur with other diseases as well. It can occur with pneumonias. It can occur with heart disease as well. So many times lung cancer is not diagnosed early because we are busy treating the other commoner things. And the only time when lung cancer is then picked up or is then diagnosed is when it has become more advanced and it probably has also spread to other parts of the body, where it becomes even more difficult to treat. That's why it's very important to be vigilant. If any symptom that's affecting the lung or the chest has occurring for a long period of time, and you are also being exposed to the risk factors that we mentioned, it's good to always get checked for and rule out this lung cancer. How do we diagnose it? So lung cancer, once you have the symptoms, you have these risk factors, the doctor will most likely do some blood tests, and importantly, he will do radiology tests like chest x-ray and a CT scan. That will show if there is any cancerous lesion or cancerous mass in your lungs. And then after that, you need to do a biopsy to confirm the diagnosis. Once it's confirmed, then you go for treatment. The treatment depends on the stage that the diagnosis has been made. Earlier stages are usually easier to treat. Sometimes if it's stage 1, where the cancer is very small, is only in one side of the lung, you can even remove it by surgery, and that could be potentially a cure for the cancer. But anything further than that is usually difficult to cure completely, but the medications that are given, that can reduce the spread and the growth of the cancer. Other treatments like radiation are also there, chemotherapy is there, and other specific therapies. So having said that, therefore, it's very important for us to know to try and detect this lung cancer early. so that we don't reach the advanced stages. So there is something called lung cancer screening, which is commonly done in the developed world. But basically what they do is anybody who is above the age of 50 and who has a risk factor, especially smoking, who has been smoking for a very long period of time, that person should go for cancer screening. And that is done usually by the CT scan, for example. So as an example, people who are above the age of 50 and they have what we call a smoking pack year more than 20. When I say pack year, I mean the number of packs that somebody smokes per day multiplied by the number of years that he has been smoking. So if that number is 20 or above, then you're at a high risk of lung cancer. So that could be somebody's smoking 1 pack a day for 20 years, or 2 packs a day for 10 years, or 4 packs a day for 5 years. That's all 20 pack years. So anybody with that number of pack years or above should get tested for lung cancer, so that it can be diagnosed early and therefore can be treated soon before it becomes worse. The final thing is important to know is always prevention is better than cure, especially when it comes to cancer, and lung cancer is not an exception. And in prevention, we try to address the risk factors that we talked about. So cigarette smoking is the number one, right? If you are somebody who is smoking, it's important to try and quit smoking. It's not easy, we understand that. It's difficult to quit smoking, but there are ways to help you go through that process. There is counseling, there's medications, and different methods that can be used to help you stop smoking. At the same time, try to reduce the exposure that you or others have to secondhand smoke. Okay? When you're working, if your job entails you to work in those factories or industries or in restaurants or places where you're exposed to a lot of smoke, it's important to wear good masks so that you prevent the inhalation, and also to keep your room well ventilated. So open the windows, okay, so to reduce the exposure that you have. Trying to do all these things, obviously eating a healthy diet is also important. Get treated with whatever underlying lung disease that you have so that you prevent the progression of that disease and reduce the risk of lung cancer. So keeping those in mind, I think that would be a very important way to prevent the chances of having lung cancer and therefore preventing the associated problems that are there with it. I hope this was helpful. Thank you very much.